불편해서 왔어요? 저기 아파?
음식물 씹을 때 소리가 좀 자주 나고.
얼마나 오래됐어?
제가 느끼기로는 3년 정도 된 네, 근데 요즘들은 좀 심해진 것 같아요.
소리도 나고 아프죠?
통증은 조금 가끔 있고 큰 거 씹을 때가 좀 자주 나는 것 같아요.
아이고 다 아프시다. 입을 벌리고 닦아. 한번 해봐. 어떤 거 비교해봐.
이게 왔다 갔다 하는 거 이렇게 그게 없어졌고, 그리고 이렇게 하면 여기가 되게 아팠거든요. 그래서 막 그냥 뭉치고 돼 있는데 안
멀쩡하죠?
아파요.
어제 처음 치료하고 오늘까지 어땠어?
일단 소리가 안 나는 거 좋아요.
소리가 안 나?
네.
벌써 안 나?
네.
어땠어?
괜찮아요.
괜찮아 계속?
네.
아이고 안 아파?
네, 아픈 거 없는데
소리도 안 나고?
소리는 되게 가끔.
빨리 나지 좋다네. 다른 데 불편한 거 없고
저는 다 좋아졌어요.
다 좋아졌어.
네.
특히 뭐가 제일 좋아졌어?
안 아프고 소리 안 나는 것도 좋아요.
안 아파?
FCST is abbreviation of Functional Cerebrospinal Therapy. It is treatment to control whole body's yin yang balance through balancing TMJ. The purpose of balancing TMJ is upper cervical alignment, spinal alignment, nervous system stabilization, and natural healing of body. That is to say that FCST helps to open up the blood channel that connects brain and body, realigning the spine, stabilizing nervous system. What factor causes misalignment of spinal structure? The answer is in C2, which is the one and only central axis of the spine. Then why is the C2 important? Human body has 24 vertebrae, which includes cervical, thoracic, and lumbar. Of all these vertebrae, there is only one vertebra with an axis, the C2. Our body is affected as axis C2 is distorted. When the axis C2 is distorted, the LSC1 is also immediately distorted, and the rest of the vertebrae in the spine will soon follow, as will the pelvis and cranial bones, like in the domino effect. Consequently, it will lead to the cranial structure fixation and the restricted flow of cerebrospinal fluid. Then, there will be problems on the circulation and central nervous system. What factor causes misalignment of axis C2? The answer is imbalance of TMJ. Once the C2 are distorted due to the TMJ imbalance, the entire structure will follow and distort. And this will negatively impact on the brain-body communication through restriction of foramen magnum, as well as restriction of jugular foramen, another opening in the base of the skull transmitting veins and arteries. When the TMJ disc space is normalized through TMJ balancing therapy, C2 is aligned as well as the size of foramen magnum is normalized. I've explained in what aspect I see the disease and its principles and concepts. I put everything in one diagram for the summary. For the better understanding, I rotated the horizontal diagram in the previous slide into the vertical diagram. The treatment applied to the higher rank can be the treatment in the lower rank. In the lower rank, more specific therapies are applied. I consider balancing TMJ as top priority factor to resolve structural problems. For the TMJ balance, I make use of intraoral devices as our main treatment. There are two types of intraoral devices used for balancing TMJ. CBA is disposal custom-made intraoral balancing appliance which allows balance of TMJ at the optimal free weight space to the individuals until deflection. The purpose of CBA is to align C2 at all times through balancing TMJ in relation to maxillary and bodily posture. TBA and OBA are intraoral devices for keeping TMJ balance stable after the use of CBA when deflection has occurred, and keeping C2 in aligned position and stabilization of occlusion and mandible. I apply a wide range of therapies other than TMJ balancing therapy. These therapies are applied for structural alignment. There are upper cervical and spinal alignment technique, spine balancing therapy, craniosacral therapy, and disc decompression balancing therapy. There are other secondary therapies as well. Depending on individual's condition and need, I apply different types of secondary therapies like as acupuncture, cupping therapy, herbal medicine, counseling program, and rehabilitative exercise program. This chart shows the number of cases in my clinic from 2002 through 2013. I listed several diseases based on the highest ratio of